Welcome back to another episode.
I just grit through it.
What is most pressing to
Really horrible.
You're getting married.
Other conditions.
Different things.
Normal changes.
Welcome back to season 3 of Is This Normal, Doc? We're excited to be back after a break. As always, I'm your host. My name's Hope. Today, joining me on this episode as the co-host is Victoria. Our guest for today's episode is one of our long-standing pediatricians of Tanner Clinic. He's a veteran, Dr. Ryan Evans.
Thank you for having me.
Yeah, thanks for coming on.
Yeah, I am the longest-standing pediatrician at Tanner Clinic.
Oh, I didn't know
I
that.
didn't know that either.
Yeah, I've been here for 30 years. I started in August of 1996, which is when the Kaysville building opened, which was the first satellite building for Tanner Clinic. Now we have a number of them. But yeah, so I've been here for 30 years.
It's awesome.
Isn't that amazing? And now, when I joined on, there were 3 pediatricians, Dr. Kramer and Dr. Tucker, who was med-peds. And then, of course, we've expanded significantly since then. I think there are 13 of us. And then, isn't that amazing?
That
Yeah.
is crazy.
The growth is phenomenal. So,
Well, it's definitely needed.
So what brought you to Tanner Clinic?
well, I grew up in Salt Lake. I grew up in Sugar House, went to undergraduate school at the University of Utah, medical school at the University of Utah, and then I did my residency in pediatrics at the University of Minnesota. So I was living in the Twin Cities, Minneapolis, St. Paul, and wanted to come back closer to family, of course. And there was an opportunity here in North Davis County. So I actually interviewed at a different pediatric group, and the person that brought me here said, oh, by the way, they're looking for a pediatrician at this place as well. Mm-hmm. So I went over and interviewed at Tanner Clinic and found, especially after watching Dr. Kramer be a pediatrician, I felt like that's how I want to practice pediatrics. And so they asked me, do you want to work in the satellite clinic? And I was like, well, I've never had a real job, so sure, put me in. And you know, the rest is history. So
fun fact, Dr. Kramer was my pediatrician.
Yes.
Oh, cool.
It's time for our favorite segment that we like to call, Is This Doc Normal? And our first question that we have for everybody is, who is your favorite fictional doctor and why?
There are so many because I'm old, but Henry Winkler's character in Parks and Rec, who is the OBGYN and is, I think it's Tom Haverford's friend.
Yeah.
Who's just nuts. He's one of the best characters.
He's like a
in that
super
show.
enabling dad of his children's
incredibly,
toxic behavior.
To the daughter and son.
Yeah.
He just gives out money left and right. And anyway, so there you go.
What is your favorite reality TV show?
It has to be The Bachelor. That's
Oh,
all there is
really?
to it. And not because I've ever watched it. I don't, but I have children that watch it as a guilty pleasure. And I have a brother whose oldest son was one of the contestants on the most recent season that had to be scrapped.
Ooh.
Oh.
Anyway, so there you go. So watch
the band
for him.
season. I don't know
Yes.
why it just humanizes doctors to be like, what's your favorite reality TV show?
Let's see.
What a small
It's like
world.
they don't just practice medicine all day. They actually watch television sometimes. So we always ask everyone a would you rather question. So my question for you is, would you rather have fingers for toes or toes for fingers?
It's got to be fingers for toes. I mean, gee whiz.
That
And
would
I
be
can
so-
grab trees and climb around. And,
Yeah, like a monkey.
yeah. Or, draw things. And my toes are pretty useless, in general.
I do think that would be funny though, because I think a lot of people picture like hands for feet, but imagine like a whole
Right,
foot with just
exactly.
fingers on the
Just
end of
really long feet.
it. I already have tingers. Victoria has mentioned
I
that
do.
too.
Tingers.
I call them Tigger.
So, but I don't have great flexibility, so that would probably be a bonus.
Right. So you'd be able to grab things.
So we're going to get into today's topic, which is ADHD. We thought it was perfect to have a pediatrician on here, someone who is seeing patients who are getting diagnosed with this, seeing the signs, and is able to really open our eyes to what some of those signs are, or some of the misconceptions, and kind of bring that to light. So I'm really interested to hear that because I tell everyone that I have undiagnosed ADHD. I did take a quiz online and it said that I was. So
Interesting.
So maybe
Wow.
that wasn't the right way to go, and you can tell me that going forward. But I think people are constantly being bombarded with information about ADHD, and not all of it is true.
Yeah, there's a
So-
lot of misconceptions out there. I see things on Instagram and it's like, oh, do you rub your feet together at night before you go to sleep? You have ADHD.
It'll
I'm
literally,
like, what is
there's
that?
so many of those. Like, do
That
you do
makes no
this,
sense.
this, and this? You have ADHD. Just to start off, I guess, what are some of the main characteristics of someone who has ADHD?
The main characteristics of someone who has attention deficit hyperactivity disorder are really three. And I always, talk to all my patients when they are coming in concerned about this diagnosis about those three main symptoms. I always like to keep it simple, The first being hyperactivity, which may or may not be present. Oftentimes it's present when a child is younger, and then as they get older, they become a little more socially aware, and so it becomes a little more internalized, in my opinion. The second thing that we see is impulsivity, poor impulse control, whatever you want to say. And then the third thing, and the thing that tends to persist into adulthood for many children, is the inattention. So difficulty focusing, staying on task, following through, staying organized, forgetful, distracted. Those types of symptoms. So those are the three main symptoms. There you go.
So you find that it changes between children and adults?
I really don't think it changes.
Okay.
I think all of these symptoms should be there in some way, shape, or form. So that hyperactivity probably is there, but it's more of an internal hyperactivity for someone who's, older, an adolescent. There is that sort of
Is that like your mind
pinging,
racing?
if you will. Yeah,
Mm-hmm.
possibly that. You're fidgety,
Okay.
restless. Sometimes, people think shaking of feet and legs when you're sitting and talking. I often wonder if that's more anxiety than it is hyperactivity. And sometimes it's difficult to know. But in the hyperactive realm, it's not always scaling the entire room and like a 5 or 6-year-old may do. But it is still there, in my opinion. In fact, it's part of the diagnosis. So, and then the impulse control, which oftentimes manifests as even things like outbursts. This is what I tell my parents. It's leaping before you look, blurting out answers, butting into conversations, not respecting personal space, can't keep one's hands to oneself, things like that. Impulse control.
Doug just pointed to me, so that means he thinks I have it. But that's good to
and me
know.
too.
Yes,
Because I
also.
invade Hope's personal
She
space
does.
on a daily.
But I think that's good to know. So moving forward, we can really say like this is not just for children who are diagnosed with ADHD, but it really can kind of present itself in slightly different ways as you get older.
Yeah, as part of the diagnosis for attention deficit disorder in children, especially under age 12, the concern has to be present in several different areas, not only at home, but also most commonly in school, because most children are in school. So we have to get input from both of those areas, or maybe from a coach or a teacher outside of school, a dance teacher, things like that. So you want to get input, maybe a grandparent. You want to get input from those outside sources to get a good diagnosis. As a person gets older, say an adult, oftentimes their personal recollections or their input on history can be a big part of the diagnosis, if that makes sense. You don't need to go and find your employer and say, do I have ADHD? Will you fill out this paper for me?
They're
It's
like,
not quite as much that way. So,
Yeah.
but with children, it's important to get input from several different sources, if that makes sense.
With children specifically, do you notice if there's a major difference between boys and girls in ADHD symptoms?
There definitely is. Boys are diagnosed much more commonly than girls. It's kind of up to debate as to whether it's more prevalent. ADHD is more prevalent in boys than it is in girls. It may not be the case, but it's diagnosed more often in boys. And that's because they tend to come to light more often, because they tend to have more hyperactive symptoms, and those symptoms tend to be more disruptive, especially in a classroom situation. With girls, they tend to have more of the, inattentive type symptoms, and those hyperactive symptoms aren't as much at the forefront. Sometimes they could slip through the cracks, especially I think in younger ages. We'll see more boys diagnosed than girls. I am seeing a lot of girls diagnosed, and I think there is a better awareness among the community about the possibility of attention deficit hyperactivity disorder in girls. But yeah, when we look at the data, it shows that boys are diagnosed more often than girls.
At the end of this episode, we're going to find out if I really have ADHD. Just as you're talking, I'm like, because I wasn't hyperactive, so I think I never really thought of that. But I was very forgetful, and I wasn't able to like really sit down and like focus. But
were you good in school?
That was going to be my next question. So what is your opinion on, is academic performance an indicator of ADHD, or have you seen kind of all around the board?
Yeah, I've seen all around the board. It can be, and it oftentimes is the reason that a family will come to see me. I tend to see some very high achieving folks, and their academic achievement is still really good, even though they're having difficulty focusing. What I oftentimes tell parents is that what we want to see is that your child is achieving academically where their intelligence is at. And oftentimes attention deficit hyperactivity disorder is more about achievement than it is intelligence. So it has, in my opinion, a lot less to do with intelligence and a lot more to do with achievement. So if that child is achieving lower than what might be expected for them, that's another indicator academically. But I definitely see children that are very high achieving and academically moving right along and struggling. And what I find is, of course, as a person goes through school into the higher and higher levels, of more responsibility and accountability is thrust upon them, as should be the case. And so at some point, that starts to become overwhelming to them because of the difficulty focusing or attending. In previous times, we did make a distinction between ADD and ADHD, but at this point, the diagnosis is always ADHD, and they're really different subtypes. So there's an inattentive subtype, there's a hyperactive impulsive subtype, but they all are lumped under attention deficit hyperactivity disorder. So going back to my previous point, that all three should be there, all three parts of that diagnosis should be there in some way. But if there's more predominance of the hyperactive impulsive part, or in the case more often of girls, the inattentive part, then those kind of become the breakdown point. So, but everything is called ADHD at this point.
What prompted that change? Did they just notice that like they maybe just were missing something as far as like their symptoms were? That's
a good question. I think, I don't know the answer to that one. DSM-5 criteria probably looked at all of the studies that were out there and said, well, it all should be the same diagnosis, and making it, that it's hard, or probably really, really hard, to make a distinction between what is ADD and what is ADHD. And so that's where you come in with that predominantly inattentive or predominantly hyperactive impulsive.
So are there any other conditions that overlap with ADHD that you find?
Yeah, many. A lot of, data shows that anywhere from 60 to 70% of people who've been diagnosed with attention deficit have some other diagnosis along with it. Most commonly, it's something like opposition and defiance, or anxiety, a mood disorder like depression, even a learning difficulty like dyslexia, even autism, an autism spectrum disorder. So yes, very commonly, when someone has been diagnosed with ADHD, they will have other conditions along with it.
What are some of the main stigmas that you see around ADHD?
I think the biggest stigma that I see from parents is that medication is going to be really detrimental to them and turn them into the zombie, that sort of a thing.
Yeah.
And I don't find that to be true very often. And I always tell parents, if we see something we don't like, we'll do something else. That's maybe the biggest stigma. And I think what happens is it causes parents and families to go searching all over the place. And I may be mistaken here, but I surmise that they often come to see me or one of my colleagues, one of the other pediatricians, because we all talk about this all day long, just so you know, after they've gone through a lot of other avenues and they've kind of run out of possibilities. And so, all right, we're going to come see the pediatrician and get on medication. And they have all these preconceived notions and beliefs and about medication. So that's the biggest thing I see.
What are those avenues that they're trying? Is it like self-medication things with caffeine or
therapy,
coping mechanisms, therapy? Is that what you're talking about?
Yeah, oftentimes it's coping mechanisms. There's oftentimes also family history. And so parents know they may have had it, or family members may have been diagnosed with ADHD. And so they'll work on coping mechanisms at home. They'll go and do all kinds of things, change of diet, supplements. There's so many different things out there. Many of them are of dubious effectiveness. And then eventually, as things may get tougher or school steps in and says, we've got to do something, then they'll come to see one of us. So.
Or can those be as effective for some children as medication? Or would you always recommend having a medication and using those as like supplement treatments? I mean, I guess it depends on the kid, but.
In my mind, those things really don't have a lot of benefit. If we get down to it, and I always tell all my patients, there are really two main treatment options. One is going and doing some therapy, whether it's as a family where you're working on parenting and communicating in a different fashion. So family therapy or personal therapy, of course. And then the second thing is medication. And at least in the studies we see, medication for ADHD is the best way to effectively treat it. So.
Yeah. And like you said, you work with parents and you work with patients too. And you see, if there is some adverse side effects that you don't like, then maybe you try another
absolutely
medication or a different dosage. I think that's the important thing that I'm like hearing from you is just work with your doctor, coordinate with each other. Because I don't think you want any child to become a zombie either. Like that's not your goal.
You don't want to dull their sparkle.
And I gotta say, it rarely happens, first of all. Yeah. And second of all, no one's ever going to force parents to do something they don't want to do or that they're not ready to do. Mm-hmm. Remember, when you're coming to see me or any of our other pediatricians, come for informational purposes, come for consultation. Nobody's going to force you into wanting to do, starting medication or anything like that. If a person's not ready, if a family's not ready. And I have many families that come in and say, yeah, we're just not ready for this. We want to go forward and see how things go in school and with some of the other things that we're doing. Now, whether they're effective or not is a whole other story. And in my opinion, those other things really have very little effect, if at all. I always stand at the ready, and that's what I tell them. That's what I'm here for. I'm here to walk beside and assist you in whatever way I can so that your child is succeeding and happy. Because many of them, because they can't focus, it becomes difficult and school becomes drudgery. And then eventually it affects their self-esteem. And then they say, what is wrong with me? And so there are a lot of implications about that.
For parents who may suspect that their child has ADHD or they don't know what's going on with their child, but they want to figure it out, I know we've talked a little bit about this, but what is the process for them to get their child diagnosed? Can you walk them through that?
Well, first of all, of course, I would have the family talk to their teacher because the teacher sees that child for many hours a day, and they can give some good insight as to what is going on. And I would talk to the school psychologist or school education person as well. Mm-hmm. And then there are good screening instruments out there. I'm pretty sure most of us pediatricians here at Tanner Clinic use the Vanderbilt assessment. Part of it is given to the parents. It's an easy assessment to do. And then part of it is given to teacher or someone else. And that input from several different sources is what gives me as a pediatrician information to know how to proceed and better diagnose what's going on. There are other levels of testing, having the school do more of a psychoeducational assessment Or if there are other concerns like a learning disability or a concern about, say, an autism spectrum disorder or, a mood disorder, then, going to see a neuropsychologist to do a full scale evaluation is the most broad-based way to know what's going on. And I will oftentimes tell parents that those are the things I have them do.
I don't know if it's just because social media has really popped off and you can see so many more sides of people's lives, but is it super common for the population to have attention deficit?
The latest studies from around the world show that the prevalence of of ADHD is around 7 to 8%. And that's, you go all over the world. I know I've seen videos of people saying, parents in France don't have any ADHD, but it's not true. That's just not true. That's just another. In the United States, those percentages are somewhere around 9 to 11%. That's what the most recent data shows.
What is your thoughts on why it's a little bit higher than the worldwide average? Is it just access to testing?
My guess is, yeah, that's what it is. There's more access, maybe more awareness as well. And so that's why there's a slightly higher prevalence. Most recent data, and it's kind of leveled off since about 2016. Those rates were going up since the 1990s to about that 9 to 11% that we see now. So in every classroom,
well, if there's a classroom of like
25,
usually 20 to 30 kids now.
Yes. So we're thinking at least 2. And that doesn't include other children that may have other things going on.
Right.
You can always kind of say about 10%.
I know we talked a little bit about some of the ways we treat ADHD, but one thing that I wanted to ask was what kind of side effects parents can expect medication to have, because I know that can be a wall that prevents them from maybe exploring that.
And I go over medication with everybody because it is such a big step for so many people to want to go on to medication, because there is such a stigma around it and there's so many beliefs surrounding it, most of them false. And so it's important to go over what are the medications for attention deficit disorder. And I use those terms interchangeably, ADD, ADHD, because they are the same thing in my mind. What are the treatment options? Under about age 6, it's a harder diagnosis to make for attention deficit disorder. And so oftentimes treatment with medication is something I don't love to do. What we usually will do, unless there's a lot of disruption and difficulty focusing, then medication could be used. But usually we stick with counseling in that age group, family therapy, parental therapy, things like that, learning those skills, which is so important. I kind of wish all of us got parenting skills class on, or just even individual counseling. Wouldn't that be great?
It would be
awesome.
Yeah.
In any case, starting around age 6 to 12, then medication and counseling kind of come together. And then over age 12, medication probably is still the first line treatment, at least for ADHD. The first medications that are prescribed are the stimulant medications. There are really 2 out there. One is methylphenidate. It's also known as Ritalin. It comes under many names: Concerta, Metadate CD, Focalin XR. They all are methylphenidate. And so that's one of them. The second one is the amphetamine salts or Adderall. Adderall XR, Adderall. Vyvanse is actually very similar to Adderall, and I tell parents that. So those are really the 2 main ones that are out there, and they're derivatives of those. And there are a lot of different brands, if you will, of those medications, but that's what the 2 medicines are. The nice thing about these medicines that I tell everybody is they work quickly. The onset of action for most of these medicines is anywhere from 30 to 45 minutes. And if you take the short-acting form of the medicine, they're going to last about 2 to 4 hours. With the extended release formulations, you're going to see about 8 to 12 hours of action with the medicine, and then they wear off. So really, parents are going to know within the first week or 2 how well this medicine may be working for their child. And of course, we always like to start low and slow on the dosage. I think most pediatricians would agree there. what side effects do these medicines have? Because they do have side effects. Frankly, any good medicine kind of does, doesn't it? It's going to have side effects.
There's a whole list usually.
Yeah.
The biggest side effect that these medicines have is that they suppress a person's appetite. They do it to almost everybody that takes these medicines. So I always tell parents, let's have your child take this medicine first thing in the morning with breakfast. Make sure they do get a good breakfast in. It's usually that lunch meal that is affected the most. And so, of course, if you haven't eaten breakfast and you don't feel like eating lunch, you're not going to feel good by the end of the day. And then as the medicine wears off, make sure that there's a good dinner. The second thing that these medicines do is they make it harder to fall asleep at night. And so it's important, at least with the longer acting formulations, that you start these medicines in the morning as early as possible. So the medicine wears off so a person can fall asleep. Oftentimes I will see some headaches or stomach aches associated with starting medicine. As we all know, almost any medicine can cause those side effects, but usually those get better with time as a person gets used to it. People do worry about things like irritability or becoming a zombie or things like that. I don't tend to see that, but if we do, like I said, we can go a different direction. Sometimes I will see some irritability as the medicine wears off in the evening. And so I'll oftentimes tell parents, well, that's your time to have your child take the dog for a walk or something.
Yeah.
I don't know.
Get some exercise.
Yes, exercise is wonderful. So those are the stimulant medications. After that, there are other medicines out there. There are non-stimulant medications. There's one called atomoxetine. It's also known as Strattera. And that's an everyday medicine. That medicine's going to take several weeks to see the full effect. There's a newer medicine on the market called Qelbree, Qelbree. And that one is similar to Strattera in that it works more fully on different neurotransmitters and is a medicine that you take every day and is a 24-hour medicine. You're going to see effects over a few weeks' time. There's also a medicine called guanfacine and clonidine that we will use. These are old-time blood pressure medications that have been used. I kind of use them as an adjunct treatment for ADHD, but some will use them as a primary treatment as well, which is just fine. So
I think we were going to talk about how dosages change.
I always feel like it's best to start with the lowest dose necessary. Obviously, as a person grows, as a child grows, they're going to gain weight, they're going to get bigger, and that dose may become inadequate. Unlike a lot of other medicines in pediatrics where our dosage is weight-based, it's not really the case with the stimulant medications, methylphenidate and Adderall. It really comes down more to the effectiveness of the dose. One person may be taking 10 milligrams and the next person who's the same age and maybe the same weight, they may be taking 20 milligrams. And so it really does come down more to what's the most effective dose that has the fewest side effects for the patient.
Right, because they're not outgrowing ADHD. It's not something that they're going to.
I do
have
have patients that will stop their medicine and they'll do well. And so it's possible. I don't know if you really outgrow it, like you said, but I think people manage it in different ways.
Well, of course, you change, you grow, you come up with new coping mechanisms or skills or whatever it is. You mature. But I did have a question about medications. I know that these are controlled substances, and sometimes people get into a little bit of trouble with that, especially on a college campus.
That risk is real. And really anybody who takes a stimulant medication like methylphenidate or Adderall, they will get better focus. It really does improve focus. Now, a person who has ADHD, their focus is going to improve dramatically more. Where we see people taking their medication or buying medication from someone else is that it does improve focus for that big, final in college or project that's coming up. And so, yes, it can be abused in that way for sure.
Have you noticed any risks of taking these medications long term?
Data shows no major risks. The one thing we can see is that over a long term, it could affect someone's growth very slightly. About 1 to 2 centimeters, maybe, which is about a 1/4 inch. I guess all of these things are risk-benefit assessments.
Right.
And so if the benefits of your medications far outweigh the risks, I mean, a quarter of an inch is, for most of us, is not a big deal. Unless you're going to be playing in the NBA, I guess.
I know. I was like, I don't know. But even
even
a centimeter, I don't think that would be.
The second thing is people have worried about cardiac side effects from stimulant medications. There's really no evidence that they affect your heart long term, although these medicines will increase your heart rate just slightly. For most people, there are a few people where it will go up even higher.
As a pediatrician, you have access to resources, and I think a lot of parents would like to be more educated and have more coping mechanisms, or their child wants more coping mechanisms. Is there any resources that you can point them to that would be helpful for someone who has a child or has ADHD?
The American Academy of Pediatrics has healthychildren.org, which is full of information. Of course, Tanner Clinic's website.
What?
we
Shameless
have
plug.
Lots of information. Your local chapter of CHAD,
what's CHAD?
Meetings regularly for folks for educational purposes. So yes, there are all kinds of resources out there. Certainly your school, and of course your local pediatrician is a great resource.
Yeah, I think that's always going to be your first line, is to see your pediatrician, right? And if there are any resources that they can point you towards in your area, I think the pediatrician would have probably the best access to resources around.
Yeah, and then getting involved with a cognitive behavioral therapist. And I'm of the belief that all of us deserve to go and talk to a therapist at some point in our lives. So that's another resource for people, and it's going to be a reputable resource rather than, your sister's aunt who's going to tell you have ADHD because you tap your foot on the ground. I don't know.
Right. I took an online
quiz.
I self-diagnosed. Me. Don't do what I do. Don't do as I do.
I also took it.
Well, and always remember, functioning is key here, right?
Yeah.
How are you functioning in life?
Right.
A lot of sticky notes.
Yes.
A lot of sticky notes, a lot of calendar reminders. As soon as I hear about something, write down on my notes
It just really has to be in front of me, and I have to be able to check it off.
So you found things that work for you, and your life is working. You're functioning well. So
you know what works for me? When the only time I really deep clean the house is if I have people coming over. It's like a
it's like it's like an urgency thing.
It's an urgency
It's like
thing.
if I have an urgency to do something, I will.
Like in college, my apartment, I lived with 3 other girls, right? But we would all deep clean like right before exams because we didn't want to study. But we were like, we can't study in a dirty space. Quick, and clean everything.
Well, I do think there is something about that mindless part of our lives where you go about and doing that, and it kind of empties your mind and allows you to maybe refocus again once you're done. So you may be doing it out of, oh man, there's so much going on. Give me a moment to do that nothing for a while. That thing that is so easy for me and I can do it mindlessly.
That's why I think kids who have ADHD are really sometimes the best athletes too. Maybe this isn't true. This is just something I've observed, but especially mindless kind of sports like swimming laps over and over, running track, something very repetitive like that. I find they do well because it kind of calms your mind and gets you out of that headspace.
Not to mention just the benefits of exercise.
Oh, for sure.
In general. We know so well that exercise improves depression. It really does improve a person's focus. And there's data out there about when a person's studying for a big test, that having a period of time off where you're going for a walk or taking the dog or swimming laps or something like that is a really good thing. And then, of course, it goes without saying, but getting adequate sleep makes a huge difference.
Also
In
very
fact,
bad.
we know that for children with, say, for instance, obstructive sleep apnea, they really aren't getting into that full night's deep sleep. And one of the side effects of that is they can't focus. They have difficulty focusing. And so it is something that we look at to make sure that that's not the reason that you can't focus or why you have inattention. So yes, it always comes back to exercise eating healthy foods, getting that full night's sleep. Those are things that I talk about multiple times every day. And I'm sure all my colleagues do too. We're talking about it all the time because it is so important.
I wanted to talk a little bit about some common myths that we hear associated with these kind of conditions. One of them being, oh, my child doesn't have ADHD. He sits in front of his computer game and can play on the Xbox for hours and hours on end. But I've also heard that that has to do with something like hyper-focusing. Like if you get really into something, you can still have ADHD and do that. But what are your thoughts?
That is true, that hyper-focus. And it seems counterintuitive to me. How can you focus on one thing and not on another thing? But it really is those mundane things like reading, writing, arithmetic that, some kids don't love. And being able to focus on those tougher things, for me, finishing that note or writing that letter for someone. Those are the mundane things and the things that aren't the most interesting thing in my life that I can hyper focus on, which video games can. And of course they draw us in. I mean, we all doom scroll at night, don't we? Am I the only one that doom scrolls?
No. I've never done that. I didn't do that last night either.
And if you think about it, those companies have spent billions, millions of dollars on being able to hook you in. And so have video games, and that ability for a child to focus on those things because they are so entertaining for them. But when it's time to do your math problems or, read U.S. history, then that's where it falls apart.
Is that where one of those stigmas come in about being lazy?
I used to see that more than I do now. I believe that we are more aware as a society that it's not a laziness thing or pull yourself up by your bootstraps. You can, I do still see that sometimes, but for the most part, people realize that these are true medical diagnoses and that they are complex. They have genetic and environmental parts to them. And it's not all about being able to handle it yourself,
Right.
Yeah.
Well, one of the myths I've heard is that if you have ADHD and you drink caffeine, it actually makes you tired. Like it doesn't. It has the opposite effect of like someone
I've
who.
heard that.
And
I hear
that's
that.
a very common one.
I'm not sure where to go with that because
I will say, once again, self-diagnosed, so take this with a grain of salt, but like I don't have very much effect with an energy drink. I don't think it makes me more tired. I don't see an increase of energy necessarily.
I don't know. I'll have like a whole mug of coffee in the morning, but if I drink an energy drink, it makes me feel so wired. Like I feel over caffeinated, right? I'm sweating. Like
when I was in high school, I went to a midnight showing with my friends, and my friend would always drink Monsters. Like he's like, Monster's my life, and he was like, try this. Like if you're tired, drink this. And so I drank it, and I was like, I feel weird. Like I didn't feel good. I didn't get more energy. I was still really tired, but it just made me sick to my stomach.
So if stimulants are good for ADHD, stimulant medication, then how come caffeine, which is a stimulant, is not as effective?
But you said it doesn't work the same way.
Mm-hmm.
Yeah.
So
why not?
Well, caffeine really works on ATP, which changes cyclic AMP into ATP, which is basically the currency of every cell in your body to give you energy, with stimulants that they work on dopamine being a neurotransmitter that goes between the synapses of the neurons in your brain and is more prevalent in the frontal cortex of the brain, which is the part of the brain involved with executive functioning.
Well, I know Hope mentioned it, but what are your thoughts on why people say people who have ADHD drink caffeine, it actually makes them tired instead?
I'm just not even sure where to go with that.
Is that
makes
like
no sense.
That's just
is that like a
myth?
I don't know. Maybe I'm just so tired that caffeine has no effect on me because I'm just too far gone. You know what I'm saying? Like,
right.
It's just like, sorry, you're just going to be bare minimum because you're already.
Well, I will say your Dr. Pepper has about, 35 milligrams? Is that
What's
correct?
the can say?
Yeah.
It's not much compared to coffee or black tea or matcha or something.
Exactly. The cup of coffee or tea, black tea is going to be 80
I think it goes like
200.
caffeine drink, right? And then coffee,
well,
black tea,
coffee's
green
probably
tea.
got as much or more than most, energy drinks. There are a few out there.
Because there's some that have like 250 milligrams
Right.
of caffeine in them.
Most of them are lower.
Oh, okay. I'll have to double check.
Are there any other myths that you've heard that you want to debunk, or have we pretty much covered it?
I worry I worry that people go out and do different treatments out there that are very expensive and time consuming. There's just no evidence to back them up. And so I do see that. I hate bashing those sorts of things, but
Like the homeopathic type things or just alternative therapies?
Yeah, alternative therapies, like neurofeedback and things like that, which they don't have any real evidence of usefulness, and they can be extremely expensive. But folks go to great lengths to treat their child. They love their children, of course they would. And boy, that's a lot. And I would love for them to just come and talk to us first and let's go over things together.
Is there anything else that you feel is important for people to know about ADHD that we have not discussed yet?
I think everybody's had that thought cross their mind at least once. Do I have ADHD? Or many times. If that's something that crosses your mind again and again, then go in and talk to someone and see if it really is true.
Yeah.
Find out what's going on.
Maybe don't use the internet as your doctor. I feel like everybody
does.
I have a controversial opinion, but I do think sometimes AI or like the internet can lead you to getting medical help.
Absolutely.
I don't think it should be used as a diagnosis necessarily, but I think sometimes it can prompt people to make that appointment. So I'm not against that. But I do think your trusted source is always going to be your doctor or someone who has that medical knowledge, went to school, sees it on a regular basis, knows the most accurate treatment for you.
Yeah, I would agree with you, Hope. I think what I find is instead of people diagnosing themselves on AI, and I just read a blurb on a study this week that said teenagers, many of them are using their AI chatbots, some as often as every day on mental health things. But what I find is instead of them diagnosing and then just stopping there, it gives them the impetus to say, you know what, I want to go talk to someone about this because this isn't. So it actually piques their interest and gets them going. And it may, I could be mistaken here, but it may get them to come and see us more often about these things. All of a sudden it's like, oh, I'm getting more information here. I probably should go talk to someone about this, which I think is a very positive and productive thing.
Yeah. And I think you get into the dangerous part when you use it as a doctor and use it as a therapist or use it as, For
sure.
So, because they say it right on there, things may be wrong. So it is better to talk to someone who knows your health history, you can talk things through with, and actually has medical knowledge of that. And I think that's always going to be the safest bet.
I am still of the belief that we as humans, we're social beings. It's important for us to sit in front of each other and talk and go over things. And having that human being in front of me who is listening to what I'm saying and can assist me with what's going on is, I think, still so beneficial and valuable.
Well, I just want to thank you for coming on, taking time out of your day to come talk to us about this. I think it's something that we know is more prevalent because people are becoming more aware of it. And I think it's good to debunk these myths and really figure out the best way to go and get the help that your family needs to function the best that you can, right? With what you've been diagnosed with. So I'm grateful that you came on here. We're able to provide your expertise on this subject. And where can people find you?
I am at the Kaysville office of Tanner Clinic. We're up on the second floor. Dr. Hoagland is down the hall from me. Cole and Tatha are down the hall from him. Just follow the noise.
And are you all accepting patients?
Yes, all of us are accepting patients. Yes, absolutely.
I'm sure they would all be happy to see you. So if anything from today's episode resonated with you, or you are finally prompted to make that appointment, I would highly suggest doing so. Whether you're in our area, you're near Kaysville, and you want to make an appointment with Dr. Evans or one of his colleagues or a pediatrician near you, go ahead and get that appointment made. Thank you for watching and listening to another episode of Is This Normal, Doc? And we will see you next time.
Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice.